We've come a long way together over the last year. Now we need everybody, we need you to get vaccinated and help put COVID behind us once and for all. It's time for everyone to say they've rolled up their sleeves and gotten their vaccinations. COVID vaccines are safe and effective. Everyone in the Benjamin family has now been vaccinated, even our youngest. Just like we've done, and just like so many others across the Midlands, it is important to protect yourself, your loved ones, and your community. Once you've gotten fully vaccinated, you'll know you've done your part in helping everyone get safely back together again. Take a look, see how easy that was. Vaccinations are free and available from great community partners all across the Midlands. Getting our city and all of our communities back to normal is almost within reach. We're almost there. This is your shot, Columbia.
Coping with COVID and In It Together present Wellness Wednesday, brought to you by the Diabetes Advisory Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Tre Tailor.
Happy Wednesday. It's Wellness Wednesday, and It Together SC and the Diabetes Advisory Council of South Carolina present Wellness Wednesday every Wednesday here on Coping with COVID. And we are here again talking about back to school. And with the COVID numbers increasing, the Delta variant surging, and to mask or not to mask being a thing at school, Assistant State Epidemiologist Jane Kelly joins us today to tell us the real deal about COVID-19, 20, and 21. Is that what it's being called, Dr. Kelly?
Well, it's called COVID-19 because that's when it started. But you're right. It seems to be going on and going on. And I mean, we're really concerned with the surge in cases we have seen this month. I mean, we had a surge last year in July after 4th of July, but this is a higher surge. And remember, this year we have vaccine and yet we're still surging. So this Delta variant definitely has us concerned.
Well, we look forward to talking to you coming up next so you can break all the information down and talk about facts versus fiction. Plus, educators like Jennifer McConnell, she is director of the Brooklyn Academy Child Development Center. She joins us. Thank you, Jennifer. We appreciate you joining us today.
You're welcome. Thanks for having me.
Also, Nurse Eunice Jones, she is nursing supervisor at Richland 1. And we also have parents. Johanna Bridget is a parent of 2 daughters, and Shay Harley is going to join us later. He has 2 special needs children. Thank you all so much for joining us today. We look forward to the conversation as we talk to healthcare professionals, school professionals, and also parents about COVID and back to school. We're going to talk about that coming up next on Coping with COVID. Thank you, ladies.
Thank you.
Absolutely. That's coming up next. But first, your COVID community update. The eviction moratorium has been extended, but only in areas with high numbers of COVID. The CDC can't extend the act nationwide, but the Biden administration has requested they pursue alternatives to help the thousands of people struggling to stay in their homes due to the pandemic job loss. We'll talk about this more tomorrow with attorneys Edie Lane and Sue Berkowitz with Appleseed. Also, City of Columbia Mayor Steve Benjamin is considering a mask mandate in City of Columbia schools in light of the low vaccine rates and the Delta variant. Meanwhile, Governor McMaster says if schools enact a mask mandate, they will jeopardize their funding. Over the weekend, McMaster told Fox News that students cannot learn while wearing masks. USC has rescinded their earlier on-campus mask mandate. The school changed their stance after Attorney General Alan Wilson said the mandate was illegal. Meanwhile, Claflin University is welcoming students back to school with new safety protocol that includes mandatory biweekly testing for all students and mandatory face coverings on campus. SCDHEC has your most up-to-date list of times, dates, and location for COVID vaccinations in and around South Carolina. Visit scdhec.gov for more information. Also, if you are a vet, the VA is handling all vaccinations for veterans. You see the information on the screen. Please contact them to get your COVID vaccine scheduled. Kroger pharmacies are offering the COVID vaccination. Check the screen for details on locations and information about that. Also, CVS pharmacies are also one of the retailers, many retailers that are offering COVID vaccinations, and that includes the CVS located in Target stores. Now, if you or someone you know is having some challenges making their COVID vaccination, Get Set Up is helping seniors and those that are a little computer challenged to make their COVID vaccinations. You can see the information on the screen. You can call or log on for more information. Hey, don't miss your shot. Get free rides to get your vaccine from the Comet bus system. The Comet is also offering vaccinations at the Comet bus station on the corner of Sumter and Laurel Streets. Again, you see that information on Mondays, Tuesdays, and Wednesdays. And please share this information so everyone can get their COVID vaccination. Now, if you lost someone due to COVID, FEMA is continuing their COVID funeral reimbursement. You can get a reimbursement from FEMA. Again, the contact information is on the screen for you to take full advantage of that. The South Carolina Bar Association and SC Legal Services have a toll-free number and website for rental and mortgage help. Also, Richland County has their rental assistance program. You can see that information. Log on to richlandcountysc.gov. SC Housing also has bill and rental assistance along with Dominion Energy. All of those resources are available and listed on the screen. Also, the Affordable Care Act is wrapping up. You've got about 11 more days to register to get your insurance, your health insurance. And if you already have health insurance, make sure you log on to the information that's posted because there are additional subsidies available. Finally, if you are having some challenges coping with COVID, the South Carolina Department of Mental Health has launched SC Hopes. It's a free online portal and also phone number for people who need help coping with COVID. Please take full advantage of all of that information. Coping with COVID and In It Together present Wellness Wednesday from the South Carolina Diabetes Advisory Council. Listen, if you are interested in a diabetes prevention program, check out the In It Together website and Facebook page for more information. We're actually streaming live on the In It Together Facebook page, so please go over there, hit like, follow, post, and share, and get all of the great information and resources that have available. We're also streaming live on the TaylorMade production page. That's the home of Coping with COVID. Please go over there and again, hit like and follow and share so that you can watch Coping with COVID Wednesday through Friday at 2 p.m. Eastern Standard Time. And then on First Monday with comedian George Wallace with Fun Day Monday. We also have a presence on YouTube. Want to thank all of you who are watching on YouTube. Please hit the subscribe button, and hello to all of those who watch us on Instagram and also on Twitter. Please go over there, hit like, follow, post, and share. I want to say hi to Deshauna Chanel. He says, hey, Trey, thank you so much for watching. And we do want to encourage you to post and share this information out so we can get the message to the masses. We are having such an important conversation today about back to school and COVID. And it's seemingly back to higher COVID numbers in our state. And with no vaccine for younger kids and varying options on masks in schools, it looks like we're heading into yet another questionable school session. We're talking today about the questions, concerns, and facts about COVID and back to school. Coming up, we'll talk to Jennifer McConnell with Brooklyn Academy, nurse Eunice Jones with Richland One. We'll also talk to parents Shay Harley and Johanna Bridgette. But first, the facts with Dr. Jane Kelly. She is assistant epidemiologist with the state of South Carolina. Dr. Kelly, thank you so much for joining us today. I appreciate you.
Thank you. Thank you for all that you're doing.
Absolutely. Thank you. So listen, the numbers are rising, Dr. Kelly. What does that mean? What does COVID in South Carolina look like right now?
It's scary, to put it bluntly.
Wow.
We have more cases this July than we have had in months. We're at about the same level of new cases coming in weekly that we were in mid-February. And in mid-February, we had very little vaccine. It was really only the elders and nursing homes or healthcare workers are the only ones who were vaccinated. And yet we're back up to that level. I think it has a lot to do with the Delta variant, but I don't think that's the whole story. I think part of it is looking at the risk people have. Now, in that screenshot that you're showing right now, people have been asking questions about breakthrough infections, saying, oh, the vaccine doesn't work if you can still get infected. You have to understand how vaccines work. They don't stop you from getting the germs in your body. They stop you from getting seriously ill. So all those green boxes, every one of those boxes represents 100 people. And so let's say every one of these people has been vaccinated. So you can see how many of them are in that green zone of they got vaccinated, they got the infection, but they didn't get it seriously. They'd had no symptoms or maybe mild symptoms.
Right.
That red box was the 100 people who might be more seriously infected. And that little tiny yellow box, that was just one person who was vaccinated who died. You know, we do have some people who get vaccinated and died. In the month of June, we had 2 people who were vaccinated and died in South Carolina. They were both over 78 years of age, and they both had other medical conditions. So when people say, oh, I don't know, if, you know, get the vaccine and you're going to get the infection anyway or die anyway, why bother? I think you've got another graphic for what happens if you are not vaccinated. Because,
is this unvaccinated COVID? Is
yeah. Now, on the flip side, I hear people say, I don't want to get vaccinated because most people just have mild illness. Well, that's true. Most people fall in those little green boxes where they get mild to moderate illness. But you see those red boxes?
Yeah.
That's over 1,600 people hospitalized out of every 100,000 people, and over 400 people die out of every 100,000 people. And those are vaccine preventable illnesses. They don't have to be hospitalized. They don't have to die. Yeah. So it's Delta variant, but it's also people's behaviors. People are, I feel like a lot of people are acting like COVID's over, and unfortunately it's not. It's back with a vengeance.
Wow.
We have 10 times more cases right now in South Carolina than we did just a month ago. 10 times as many.
Wow. We're talking to Dr. Jane Kelly. She is Assistant Epidemiologist for the state of South Carolina. I'm Tre Tailor. You're watching Wellness Wednesday from In It Together SC and the Diabetes Advisory Council of South Carolina. We're talking about back to school and COVID. So where we are in South Carolina, Dr. Kelly, how does that compare to the country?
South Carolina is number 40 in vaccinations.
So, and out of 50 states.
Out of 50 states, that's right. So we are way down.
We're number 40.
We're way down in terms of the number of people vaccinated. But until recently, we were really, to be honest, low a number of cases, right? We had, in May, we had maybe 100 new cases a day. But at this point, we are at a substantial to severe to high level of new infections. So, okay, we are not as bad as some of the other southern states. Some of the other southern states are being overwhelmed. Their hospitals don't have the capacity to take care of everybody. Their ERs are filled, so they are having to divert patients. Can you imagine arriving in the emergency room? Maybe not with COVID. Maybe you arrive in the emergency room with a heart attack and they can't take you because it's full of patients who have COVID. So we are not overwhelmed yet, but we are headed in that direction.
Wow. So is this the Delta variant or a combination of COVID-19 and the Delta variant?
It is a combination, absolutely. Now, the thing to understand about the Delta variant is it does spread more quickly. All the variants spread more easily, but the Delta variant spreads more quickly than any of the others. It's thought to give you a viral load, the amount of virus in your respiratory system, more than 1,000 times higher than the other variants. Yeah. So it is definitely partially the Delta variant, but it is also the fact that people are unmasking. People are not playing it safe. We have had outbreaks in schools, daycare settings. We've had outbreaks in summer camps. A couple of schools are already back in session.
Right.
And we've already had, there's one school in particular, we had, 6 kids, one school district in particular, 6 kids infected, had to quarantine over 70 others. So if those things are foreshadowing for the fall, we're deeply concerned.
And you say, people are unmasking. It's hot. People have mask fatigue. I guess that's what it's called. They're just tired. So who is getting COVID now? Is it the unvaccinated?
I'm so glad you asked that question, because overwhelmingly it is people who are not fully vaccinated. Either they have no vaccine, or they've gotten just 1 dose, or they just got their 2nd dose. Right now in South Carolina, 68% of the new cases are that Delta variant. That little figure is showing, starting all the way over on the left, that was in April, and then early May, late May, early June, late June. Each step of the way, you can see that Delta variant in the dark orange. Boy, it just really spread.
Wow.
Now that's for the nation as a whole. And for the nation as a whole, it's more than 85% of the new cases are Delta variant. In South Carolina, it's 68%. So my concern is that Delta variant has just more recently gotten here. As it starts to sweep through the state, like we've seen in other states. Missouri, over 90% of their cases are Delta variant. So people don't realize the game has changed. We are in a worse situation in many ways than we were this time last year. This variant is more contagious.
Yeah.
The good news is vaccines do work against the Delta variant, and I hope that we can address people's concerns about getting vaccinated, because this is going to be our best tool to fight back against the Delta variant.
Right. We're talking to Dr. Jane Kelly. She is Assistant Epidemiologist, the state of South Carolina. I'm Tre Tailor, and you're watching Coping with COVID. Wellness Wednesday is brought to you by In It Together SC and the Diabetes Advisory Council of South Carolina. We're talking about back to school. We're just around the corner, and kids are going back to school. There is a debate right now about to mask or not to mask in our schools. Of course, our governor says, I mentioned in the news segment, he said kids can't learn while they're masked. But here, at least in Columbia, the mayor is considering a mask mandate for in-city schools. Is there any word, Dr. Kelly, on when or if children under 12 will have an approved vaccine?
They are working on it. There are studies going on for both Pfizer and Moderna looking at vaccine for kids under age 12. But I think we're still several months away from that. It's more complicated. You're dealing with kids of different age, different size, different developmental issues. So it is going to take longer before we have a vaccine for kids under 12. Right now, though, it's not as though there's nothing people can do. The best way that you could protect your child under age 12 is to protect around them. Get everybody around them vaccinated, friends, family, talk to other people. If you've been vaccinated, that's great. Tell your story, though, to others, to other parents, to teenagers, so that they understand why you got vaccinated, what you experienced. And if you're not vaccinated, get the facts, talk to your physician, talk to your pharmacist. You can email me. I would be glad to discuss whatever concerns people might have about the vaccine.
Wow, that's great. And Dr. Kelly's information is on the screen, as she is so graciously offered. Give her a call, email her, and ask her the questions that you want to know. She is the Assistant Epidemiologist here in the state of South Carolina. Now, kids have to get their immunizations, have to have them up to date. Will this make any difference with COVID, Dr. Kelly?
Sure. For example, we're coming into flu season. And kids going back to school every year, we recommend update their flu vaccine, get the new flu shot. And the same thing is true this year, because one of the things that getting the flu shot can do is by reducing your risk of getting the flu, then that reduces your being vulnerable, so that you're less likely to get COVID-19, for example, because you're less vulnerable. Each of us has to weigh benefits and risks.
Right.
The benefits of the COVID vaccine, they're highly effective. and against the risk of getting COVID-19 disease. And people think, well, if kids get it, they don't get it too bad. They don't have much in the way of symptoms. They're forgetting about long COVID. Those symptoms of brain fog or fatigue, the kid has trouble focusing. That is still true for children, teenagers, young adults. That long COVID is something real.
Not only that, they can give it to somebody else, right?
Yeah, exactly. But for those kids under age 12 who can't get a COVID vaccine, there's still other things they can do. We still recommend getting the flu shot, getting the influenza vaccine, because the more you can decrease other respiratory illnesses, the more you can hope to prevent their immune system getting overwhelmed and making them more vulnerable. But the other thing, masks do work. I mean, we saw that last year, that masks made a huge difference in the spread of the flu, for example, and RSV, that's another virus that kids get. We had very little flu and RSV last year because kids were masking up. And I understand the governor has his viewpoint, but I can only quote the American Academy of Pediatrics. They recommend masking. They feel that in-person schooling is very important, but they also have come out with a statement that kids can return to in-person school and remain safe by wearing a mask and keeping distance.
Well, we're going to talk to Jennifer McConnell with Brooklyn Academy. She houses infants through 5-year-olds. And then, of course, Nurse Eunice Jones with Richland One. She is the nurse supervisor. We're going to talk to them in just a few minutes about just this issue as far as masks and children. We do have a question. Johanna wants to know, what about diet and nutrition to support the immune system? How does that factor at all, Dr. Kelly? Thank you, Johanna.
That factors. It's important, eating healthfully, being physically active, being, overall general health does improve your immune response. So if you have a medical condition, for example, if you have a chronic condition, maybe heart failure or diabetes, it's important that you talk to your healthcare provider. What can you do to strengthen your immune system by getting your medical condition under control? But I have to say, that if we're talking about a very specific disease like COVID-19, the most important thing you could do, honestly, is get vaccinated. I mean, these vaccines have been engineered to be highly specific, to give you even better immunity than infection itself.
Yeah, Dr. Jane Kelly is with us, and we're talking about COVID and back to school. Johanna had a comment, and she's one of the parents that are going to join us a little bit later. And you mentioned a little bit about people with underlying health conditions. And I wanted to ask that: diabetes, heart disease, hypertension. I mean, this show is sponsored by In It Together SC and the Diabetes Advisory Council. And we know with COVID, there was an increased concern for folks with underlying health conditions. Is that still the case with the Delta variant?
Yes, it is. We don't have firm evidence that the Delta variant itself it makes you sicker. It's just that it's more contagious. It's going to spread more easily.
Wow.
So if we have more people getting infected, then probably we'll have a greater number of people who have those medical conditions that cause them to be at greater risk. So that is definitely a concern. And Delta variant is going to be the same as the others in terms of hospitalization, need for ventilation, and lowered oxygen support.
Yeah, I want to ask you a couple of more questions before we take a break and then bring the rest of the panel back in. And you mentioned a little bit about this. I think I'm getting you really answered this question. What needs to happen in schools to prevent the spread of COVID, Dr. Kelly?
Our guidelines have really not changed around most things in terms of schools. Our advice is very similar to CDC's advice. Our recommendations are kids need to return to in-person learning, and they can do it safely. A lot of schools did a great job last year with doing it safely. It's the same recommendations: wearing a mask except when eating or drinking, wearing a mask in indoor settings, keeping a distance. We are recommending keeping a distance of at least 3 feet between the kids. And ideally having the desks all facing in the same direction so you don't have children facing each other and 3 feet apart. And the reason for our 3-foot recommendation is based on some studies that were done in Europe, where they were keeping kids separated by 1 meter. 1 meter is just a little bit more than 3 feet. If schools can accommodate keeping them even further apart than that, that's terrific. But masking works and is critically important. Some of the other measures, hand washing, ventilation, if the weather accommodates it and you can open windows to get more air flowing through, that's the best. If the weather is right and kids can eat outside, that's certainly better than eating at their desks. But eating at their desks is better than going to the cafeteria and mingling.
Where you've got a bunch of kids there. Yeah.
Yeah.
So what can we do in the public? That's the schools. What about in the public? What we need to do to help stop the spread of the variant and COVID?
CDC's new recommendations were that everyone wear a mask in indoor settings. And I think that has confused some people. So let me try and make that a little bit clearer. The reason for that recommendation is that Delta variant spreads so easily, so quickly, that we want to pull out all the stops. So that certainly if you're unvaccinated, you place yourself at great risk of contracting COVID-19. If you go to an indoor setting with other people who you don't know if they may be carrying the virus, you place yourself at great risk if you don't wear a mask. So we ask you to wear a mask. What about people who are vaccinated? People who are vaccinated are, overwhelmingly protected from severe disease, hospitalization or death. The vaccines are highly effective for them. However, they will not protect you from getting asymptomatic infection, meaning that you pick up the virus, your immune system fights it off because you're vaccinated, but until it fights it off completely, you might still have the virus in your upper respiratory system and shed it, give it to others. So that's why we're asking everybody, let's stop this thing in its tracks until we can get more people vaccinated, and asking people whether you're vaccinated or not. If you're in a crowded indoor setting, please wear a mask.
Yeah. And so do you think it's more about getting people more vaccinated, wearing a mask, or is another shutdown needed at this point?
Vaccine is how we get out of this pandemic. Vaccination is really going to be the end of the variants, and that's what we need to do. In terms of a shutdown, that's not my decision. I think if people would attend to these, what we call mitigation measures, masking, distancing, washing your hands, staying home if you're sick, getting tested if you've been exposed to COVID. I think we can do it if we can get everyone to join together to take those steps.
Yeah, Dr. Jane Kelly is the assistant epidemiologist for the state of South Carolina. She rejoins us next, along with Jennifer McConnell, who is director of Brooklyn Academy, CDC, Nurse Eunice Jones, nursing services supervisor at Richland One, and parents Shay Harley and Johanna Bridgette. That's coming up next. Wellness Wednesday is brought to you by In It Together SC and the South Carolina Diabetes Advisory Council here on Coping with COVID. We'll be right back.
You can eat what's good to you and good for you, too.
Yes.
Get the Dash for Southern Soul Cookbook free. All you have to do is ask. It's packed with delicious Southern-style recipes with a healthy twist.
Yummy.
You won't be able to taste the difference, but you will be able to feel the difference.
Yeah.
Inbox your email address to the In It Together or Tailor Made Productions Facebook page, and you'll get it straight to your mailbox. The Dash for Southern Style Cookbook and a Coping with COVID face mask. From In It Together SC, the Diabetes Advisory Council of South Carolina, and Coping with COVID.
Coping with COVID with Tre Tailor.
Computers, they're a part of our everyday lives, but when they're not working, they're an everyday problem. So call Computers Unique, your everyday solution. 803-351-5821. Is your computer running slow? Won't turn on? Do you need a screen replaced? Or maybe you just need another computer? Well, Computers Unique is your one-stop shop for all your computer needs. They have a wide variety of new and pre-owned PCs, Macs, and tablets. So call Computers Unique, Dutch Square Mall. 803-351-5821. 803-351-5821.
Let Palmetto Painting Services take the worry out of your next home painting project. We can paint anything. Our business is about interior painting and exterior painting. We offer services for residential and commercial properties, Restore the life to your home with a fresh coat of paint from Palmetto Painting Services. References are available upon request. Give us a call at 803-546-4570 today.
How will you remember the year 2020?
COVID.
Losing my job.
Working 12-hour shifts in a mask.
Losing my grandma to COVID.
COVID has claimed thousands in South Carolina and strained our health system, schools, businesses, and families. If you're struggling and need to talk, call SC Hopes. That free call can help put you in touch with people who can help. This goes for healthcare workers, teachers, restaurant employees, parents, anyone and everyone. SC Hopes, mental health and addiction support for challenging times.
Coping with COVID presents Wellness Wednesday from In It Together SC and the Diabetes Advisory Council of South Carolina. Listen, if you are interested in a diabetes prevention program, check out the In It Together Facebook page and website for more information. We're actually streaming live on the In It Together Facebook page. Please go over there, hit like, follow, post, and share. And do the same on the Tailor Made Production page where we are streaming live. Also, don't forget, at the bottom of the screen, we've got several resources available that are streaming throughout the show. If you need information on finances, on finding a COVID vaccination anywhere in South Carolina, please check the scroll at the bottom of the screen and check out the various resources we have available. We want to remind you, too, to please post and share this information out. It's back to school, and people need to not only hear from what Assistant State Epidemiologist Dr. Jane Kelly said, but the folks that we've got on the show coming up next. Mitchell Peace Joy Jen says great information. Hey, thank you, Mitchell, for joining us on Coping with COVID. Again, please post and share this information out. We're talking about back to school amidst the resurgence of COVID in our state. Dr. Jane Kelly, as I said, Assistant Epidemiologist, just talked to us about the increased number of cases, and with kids returning to school in just a few weeks, and to mask or not to mask, a big option in our schools, we're addressing the concerns and protocols schools are putting in place. Jennifer McConnell joins us. She's director of Brooklyn Academy CDC, which houses infants through 5-year-olds. Nurse Eunice Jones is nursing services supervisor with Richland One. And Johanna Bridgette is a parent of 2 daughters in the Richland School District. And Shay Harley is with us. He is also a parent of 2 special needs children. Thank you all so much for joining us today. I appreciate it.
Thank you for having me.
Absolutely.
Glad to be here.
I want to start with you all, parent Johanna and Shay. Are you concerned about going back to or sending your kids back to school in the midst of COVID?
Absolutely. Absolutely. My biggest concern is the masks are not mandated. The school is open to everyone. So even if the children, let's say I have Jada, who's a 12-year-old, she's right at the cutoff for getting vaccinated. Some middle schoolers are under the age of 12. And because of birthdays, they can come in sooner. They're not eligible for the vaccination. We're hoping that their families are vaccinated. And I have her ready to, she is trying out for volleyball. So we have a sport. She plays violin, most of which if the woodwind section or the brass section plays, they don't have a mask on while they're blowing into their instruments. So there's a lot of exposure for her. For Jamie, she's back on campus at a huge high school. Though most of her classes are not on, she still has to go in the building. I am very concerned.
Yeah. Shay, what about you?
Trey, and thank you for having us on. I'm always grateful to be in your presence.
Thank you.
I am very concerned, and I don't know if you can see, but there are fumes coming from my head right now because I am so hot and bothered and angered about how this entire thing is being handled, how it's become politicized, how our governor obviously does not care about public education, doesn't care about our teachers. And if you don't care about our teachers, you don't care about our students. And I'm just so bothered by how we're getting these children to go back to school. And I'm hearing all this great information about COVID and masks and vaccinations, and that's great. I think me and my family, we're vaccinated, but I'm worried about their psyche. How are our children in their mental? If you look at our communities, there's teenagers getting shot, seem like every week, And so if we're going to open up the schools and just shuffle our kids back to the schools, I feel like that's COVID's one of the it's the biggest problem, but probably like 1A is their psyche and where everybody's head is at. And also the shortage of teachers. Nobody's talking about this stuff. And so those are some of the biggest things. And also with me having special needs children and the fact that they've been bullied, I'm worried about those things too. Yeah. So we've chosen not to have my children at the school. They're still going to be doing virtual.
Well, I was going to ask you that, were your kids going back? So they're going to continue to go virtual, and there is that option. What about you, Johanna? Are Jamie and Jada going back in school?
They actually are going back in school. Virtual is for year-round virtual. It's not an option like it was last year where you can start off virtual and then move on campus. We're in District 2, and if I understand it correctly, our superintendent will have a meeting this afternoon where he broadcasts his meetings with the board at 6. But my understanding is if you want to continue virtual, you have to go to SC virtual. It's not like through the individual districts. So my girls do technically have to be on campus. For Jada, socially, as Shay spoke about, she needed to be there. Honestly, the last 30 days of last year, we sent her back on campus. I was losing my A student. She completely tapped out. She wasn't engaged in even her favorite classes. Math comes easily to her, and she was struggling in it by grade because emotionally she was out of it. We sent her back that last 30 days. She went right back to A. She was happy to engage, but the school was very proactive with the social distancing. That's with a handful of students. I think they had a fourth of their population. Now you're having up to 90 to 100% of the kids back.
Yeah,
I heard what she said about keeping 1 to 2 feet away or 3 feet if you can.
Right.
I don't see it happening. I don't.
Really?
If you've ever seen the hallway of View High School in between class changes, there's no way.
No way.
Wow. Jennifer, you've got the babies over at Brooklyn. And to my understanding, you had not one case of COVID or outbreak this past school year.
Wow.
What did you put in place that worked for you? And how many kids were in there?
Got it. Thank you so much for the invite, and I'm certainly enjoying the conversation. So yes, I am the director of Brooklyn Academy Child Development Center, where we have students ages infants to age 5, Monday through Friday. We were closed for when the COVID first began. So from March to September, we were closed, and then we reopened after Labor Day. And the parameters that we put in place to return was to keep the lines of communication open with our families, letting them know that we took the virus just as serious as they had for themselves and their family members. I especially took to it because I had a family member that passed away from COVID-19 back in May. So it was a big deal to me that we understood that this was the only way that we could reopen our doors if everyone could be on the same playing field and understand the importance of having children return in mask. And, a lot of parents were skeptical, even educators were skeptical that children of our age group would not wear masks, that they would probably share a mask, or that they would take the mask off and use it as a slingshot. But I'm happy to report that our children 3 and up have worn a mask from September until today.
Wow. And
they will continue to be in masks. The other things that we did is that we did temperature checks. So when parents arrived at the center, we greeted them at the entrance door. We took their temperature. Parents were very compliant. We asked our parents to also arrive in masks when they're dropping off and picking up children. And then one of the biggest changes that we made was not to allow parents to enter through our interior doors. So we are fortunate enough that we have access to all of our classrooms from another door where you can go directly to the child's class. But that came with putting some more parameters in place because we wanted to make sure we were keeping our children safe. We wanted to make sure parents understood that we weren't compromising safety for dollars. So parents went through the whole process, understanding that we were in it together, and that if one person decided to go to the beach and have that family vacation, they could very well be the family that comes back and jeopardize the whole center. So I would say they held out pretty good on not having those social setting environments where it could compromise, overall well-being of our students as well as our teachers and staff. Washing hands became a much bigger priority. So upon arrival, children were washing hands. We also have additional temperature checks throughout the day, because just like what we were concerned about with our older students, it was hard to think that we could social distance. So we don't necessarily have social distancing in place for preschoolers, because they like to hug, they like to high five, they like to share. And so there are some things that we did, like reducing our classroom sizes. So typically in a school year, we would have 94 or more students enrolled in our program. But due to COVID, we had 56 students enrolled. That means out of our 7 classrooms, we reduced our classroom sizes, 10 students or less. And yes, that was a big hit, because of course we understand that in order to function as a small business, you need those dollars. Yeah. But dollars does not outshine the life of a child and a teacher that we said that we would keep safe. And so I think our parents can say they appreciate the fact that we made COVID-19 our top priority, but not the only focus, because our children are still learning. So I am in total disagreement, when I heard that children can't learn with a mask on. Then that would mean you threw away our whole school year, where we have 17 children that graduated and are ready for kindergarten. They graduated back in June and they are ready. And the children that graduated in 2020, unfortunately, their kindergarten year was not as what parents envisioned. Everybody gets excited for their child to finish preschool to go to kindergarten. And so I'm looking forward to our children entering kindergarten ready, where teachers won't have to constantly remind children to wear a mask because they've already started the process. And I have to give those kudos to parents, because when we return is what we instill in our children. So if you're already speaking negatively about masks and you're having a temper tantrum as an adult about wearing a mask, that transfers to your child. Yeah. And that tantrum, then you can see from elementary through high school, through college, through the workplace, that adults are having tantrums that's bleeding over to our children. But when our kids came back in September, one of the few things that we had to go over with instructions was our mask. Our children kept their masks on. They took them off during rest time. They took it off during meals, and they took it off when they were outdoors. The biggest change in masks that we have is the fact that they like to change it when they sneeze or cough in it, and that's understandable. But we have had much success because our parents took the lead and instilled in our children what it meant to be healthy and safe. Even for children who look over at their neighbors and say, hey, we can't share our food, or you can't touch. And they understand that we have to keep our space when necessary. But then there are times when they do connect, and that connection is needed.
Yeah, wow. Just Jennifer McConnell, she is the director of a Brooklyn Academy Child Development Center. Girl, you're over there preaching good. Kawan Fitch-Webster says, kudos. I'm going to get to you, Nurse Jones, in a minute, but I'm going to get you back in here, Dr. Kelly. What do you think that what Jennifer has put in place at Brooklyn CDC has been the key to their success? No, not one COVID outbreak.
I mean, that speaks for itself. That's incredible. And the main point here is it can be done. Yeah. I think sometimes people just feel like helpless. Oh, this Delta variant, it's just whipping through everything. There's nothing we can do. Oh, we don't have vaccine for under 12. There's nothing we can do. That's not true. There are things that you can do. You would like to have more of them. You would like to have vaccine for under 12, but we're not there yet. But it can be done. And you're proof of that. And kids, I think we were all concerned about how are we going to get kids to mask up. I mean, and I had the same scenario, same thoughts. I've got some nephews who are under age 12, and way back March 2020, I saw the writing on the wall, and I bought all the kids' masks, thinking I need to start introducing this concept now. they liked it. They thought it was fun. I mean, they embraced it. So I know they can do it. And I agree with you that a lot of what, kids, their attitudes are reflections of what their parental attitudes are.
Yeah.
Kids can wear masks safely, but they need that parental support.
Right. That's Dr. Jane Kelly. She's assistant epidemiologist for the state of South Carolina. You're watching Coping with COVID. In It Together SC and the Diabetes Advisory Council of South Carolina present Coping with COVID every Wednesday here. I'm Tre Tailor. Kawan Fitch wanted to know what preschool is it? And then Samantha Gleaton says Brooklyn Academy CDC. Thank you, ladies, so much for watching. Please post and share this information out. Nurse Jones, you are a nursing supervisor at Richland 1. Now, does every Richland 1 school have a nurse or some kind of medical somebody there?
Yes, ma'am. So currently we do have 3 openings, but we are actively filling those openings. And so last year we did have a nurse at every school. Yes, ma'am, we did.
And will that be the same in lieu of COVID?
Yes, ma'am. That is the drive for us to have a nurse at every school, as well as if provided a UAP that would be assistant to the nurse.
All right. And what's a UAP for those of us? I'm going to say for me, because I don't.
So those are individuals that have been designated by the principal that will be trained under certain things that they can do in their scope to assist the nurse. There, of course, they couldn't practice as a nurse, but they're assistant to the nurse to help with management of the children.
Are there additional practices, protocols, conversations? What are you guys putting in place in lieu of COVID? I mean, we kind of opted out of school last year very early, and now we're going back to school with, as Dr. Kelly said, higher numbers and an additional thing in the mix with the COVID variant. What kind of things are you guys putting into place?
So we've been kind of ahead of the game, as I'd like to say.
Right.
We started last year. And so the design of our health rooms, where we will take intake of children, how many we will take in, making sure that it's the minimal amount, not taking away, of course, if it's an emergency, how would we interact that way? Also, we established isolation rooms. So students that have with fevers or any type of symptoms, then we do not bring them to the health room that is considered the clean area. We will take them to the isolation room, and they would be escorted by a monitor that has been trained to identify and also take temperatures and place them in the isolation room, which provides that 6 feet distance.
And is this if a child appears to have any symptoms?
Yes, ma'am, that is correct.
Okay. All right. Kids have the option to mask or not wear masks per the governor's mandate. What about staff at Richland 1?
So again, that is the same thing. It is not mandated, but it is highly recommended, as our superintendent had stated on yesterday evening on the news, that he does highly recommend for them to wear masks. And we think that is important. That's number one safety for prevention.
How are staff feeling about going back to school amidst COVID?
Not directly having that input yet, but from last year's intake, they were kind of anxious. It's something new. What do we do? And now that we have this new variant, it's a lot of questions. But here we try to always lead with education, have that open forum, not only with our school nurses, but our principals, our executive directors, the upper administration are so wonderful in supporting us and keying in on what is the need. How can we better fit and support our school?
Yeah, I want to ask Shay and Johanna, and I see Jamie's there. I want to ask her another question. But before that, I want to get back to you, Jennifer. You said that parents were very supportive. What about staff? How were they responding to the new procedures?
I am thankful for my staff. Because prior to returning in September, we met as a staff to talk about the protocols that would be in place. And again, they too took the virus just as serious. And so we have our range in employee go from 21 years of age to 77 years of age. Mm-hmm. And the persons that we were most concerned about was our 2 senior persons on staff, age 72 and age 77. And everyone wanted to make sure we kept them safe. But also our staff have children. Some children are school age and some children are under the age where vaccinations aren't available just yet. And during the beginning of the pandemic, we didn't have a vaccine, if you remember, of course.
Right.
So at that point, everybody was at a heightened alert. and you almost feel as though you are helpless until you're told what you can do to prevent it. And that was wearing the mask. And so our staff is still wearing the mask. We will continue wearing the mask. The majority of our staff, if not all of them, have already been vaccinated. We went as a team. So those who were on the fence, they actually listened to each other. We talked about it. We went through the whole conversation about what fears they had in getting it. We held hands for those who needed someone to hold a hand to get the vaccination. But one of the things I also thought about when you went on someone else was the thought that we did change one of our processes where instead of combining classrooms, children were assigned specifically to their classroom. And so we had minimal movement in the building. And that way we could understand and contain an outbreak if it took place. Because what we have seen in childcare, of course, is because kids are much more susceptible. Yes, they get immunization. Yes, in order to be there, they must be immunized. But at the end of the day, there are still illnesses like hand, foot, and mouth that spreads quickly. And we understand that when children combine from one age group to the next, you don't know who brought in the hand, foot, and mouth. All you know is that the majority of the class or classes are now impacted because it is a viral infection or a viral disease. And so the teachers have done a phenomenal job in even making sure that our sanitation process is up to date, all day, every day, sanitizing, sterilizing, making sure that even our maintenance team understood that we have precious commodity. And so making sure that we were clean was at the top of the list. So that goes hand in hand as well. Your environment must be clean as well as your physical, personal body needs to be clean.
Right. That's Jennifer McConnell. She is the director of Brooklyn Academy Child Development Center. Nurse Eunice Jones is nursing supervisor at Richland 1. Nurse Jones, and you mentioned when we spoke earlier that there are a couple of vacancies at some of the Richland 1 schools. What happens if school starts and you don't have everyone in place?
And so what we use is we also use a nursing agency, which will fill those holes for us until we find a permanent replacement. Yes, ma'am.
Okay. So you're not gonna every school is gonna have a nurse.
Yes, ma'am.
When school starts.
Yes, ma'am.
All right. We want to go back to the students. Jamie, I see Jamie has joined us, and you're a rising senior. Jamie, congratulations. How do you're welcome. How do you feel about going back to school, honey?
I'm a little scared. Because I know at Ridgeview we always bump shoulders in the hallways between class changes because it's about 1,500 people at Ridgeview, one floor. And it's a bunch of people going through 4 halls at Ridgeview. I know that I'm taking more advanced classes my senior year, so it's going to be less people in the classroom, so I have a better chance of social distancing. But I just going in between my classes what I'm really worried about because I need to go to the next class. But it's that, and I'm also working at Chick-fil-A, and although Chick-fil-A does have a mask mandate, it does not mandate that other people have to wear masks like our customers. And I know a lot of kids at Ridgeview are not going to wear the mask. They're going to wear it.
I was going to ask you about that. What are your friends saying about that? And Shay, I see your daughter's there with you. What are you hearing your peers, your friends, your classmates saying about the mask, to mask or not to mask? That is the question.
I'm not sure. I've spoken to some of my classmates about if they've gotten the vaccine or not, but I can't say that for all of my classmates. And even if they think I have the vaccine, they have that mindset. I have the vaccine. I don't need to wear a mask. Right. So I'm not sure. I'm going to wear my mask.
Oh, yes.
Yes, you will. Okay. And, try to sit in the corner, walk a little faster in the hallways, go to my next class.
Yeah. What about your children, Shay?
Well, my daughter's been like fuming just like me, so I'll let her answer that question.
Okay.
Is this still about the masks and stuff?
Yes.
Well, I won't know since I'll be in virtual school for at least like the first half of the school year. But I have smart. I'm lucky to have smart friends. But I know some people in the school aren't going to wear their masks just because, you know. And I mean, I want to go back to school, but at the same time, I'm scared because of like all the stupid stuff people are going to do there. Don't even get me started on the crazy kids. And, you know, because like on the news and stuff, people are acting crazy in the streets and stuff. And that's gonna be, in school, that's gonna be like that, but on steroids. So I'm planning on keeping my butt here until it's at least safe.
Yeah.
Well, yeah.
All right. And yeah. So both your kids, both twins you're going to keep them home indefinitely.
Well, and so with the virtual program, like Joanna was saying, that you're supposed to stay in the virtual program all year.
Right.
But I'm sorry, I'm going to do what's best for mine. I'm going to keep them in school for at least the first 2 quarters. I'm going to reassess. And if I want them to go to school physically, then I'm going to have to write a letter and fight whoever I have to fight to get them back into school if I got to get them back in there physically.
I also want to get back to drama and stuff because we haven't really been doing anything since 2 years ago.
Right.
It's been like 2 years since we've done like a play and stuff, and I was really sad when they said we weren't going to do a play this year. I was like, what? No way.
Yeah.
So I eventually want to get back to that, and chorus too. Because last year was the last time I had my teacher, like Mr. Graham. Yeah, Mr. Graham. And so now there's going to be a different teacher, but I'm sad because he's kind of one of the best teachers I've ever had, you know?
Yeah.
So he was a good teacher and she didn't get to experience. He's a really great chorus teacher.
I've only experienced him for like a
1
year.
And he's gone. And so she missed that whole camaraderie, drama, chorus, and she likes to do voiceovers like you, Trey. So maybe you can.
I would love to talk to her about it. I responded to your post on Facebook, but I digress. So listen, yeah. So in closing, Dr. Kelly, what are your final thoughts? I mean, you've heard the concerns of the young people. You've heard what the nursing supervisor at Richland Luna said, and Jennifer at Brooklyn Academy CDC. And before we go to you, and so I do want to ask Jennifer, are the same procedures in place for this coming school year, or are you doing anything different?
Yes, the same procedures are in place. We will not increase enrollment at this time. And a part of not being able to increase enrollment also is hand in hand with not having the staff. So the staffing shortage is not just in our public school system or private school system, it's also in our preschool programs. And because of that, you have several persons that are just staying clear of the education field right now. So yes, we will still follow the rules and that the CDC guidelines have given us, and we will continue to take care of our little bit citizens of South Carolina.
Yeah. Nurse Jones, any final thoughts?
The main thing, like you said, highly recommend to wear those masks, that education piece, not only, for the children, but also for the parents, that they can make the best decision to support and keep their children safe.
Johanna?
Of course, we would just keep our children covered in prayer. They know what to do, what not to do. They understand differences, because one of the bigger things is, yes, although we're vaccinated, we can still get it. And we have my mother who has severe respiratory issues, inhaler, the mask, the EpiPen. Thank you, baby. The EpiPen, and she actually does the steamer, the mask that she has to wear. So it's not just in schools; they can get it and can spread it to her. And of course, she's elderly. She's in that age group. That's a big concern of mine. I want my children to enjoy school. Jada should enjoy finally being in middle school. Jamie
should enjoy her senior year.
Jamie should love her senior year. And I just hate that they have this one more emotional thing to be concerned about, because Shay's daughter made a good point. You already have the stresses of school. You have the situations with the kids that are bullies, or you have the teachers who are tired of jobs. You have that in addition to now you have a virus on top of that. And of course, Jamie would share that, some of her classmates didn't have their basic needs before the pandemic. And now they're coming out of it with maybe even less than that.
Yeah.
And so she supports her classmates that way. And you're putting a virus on top of it. That's a lot of stress. That's a lot of stress.
And that's another show. And I definitely want to, do a show on mental health, because that continues to be a huge part of the medical effects of the pandemic, has been the mental health strain that it has put on all of our citizens. Correct, Dr. Kelly? And I'll give you the final word.
Thank you, Frank.
Absolutely.
Absolutely. And mental health in terms of responding to that stress is different for different people. Some people will be classically depressed with crying and express that sadness outward. But for kids and teens, a lot of times what they do is withdraw, and that they're spending more time isolated, and that, grades go down. But more importantly, there are scary thoughts going on inside of those young heads. And we don't want to see an increase in suicide attempts, successful suicides. And yet that is an important consideration. The more we can get some camaraderie around this, the more we can have community support for one another and not be arguing over things. I mean, we know that, while I say vaccine is our way out of this, we also know that there are success stories out there. There are things that can be done. You proved it at Brooklyn Academy. There are things that can be done to keep the kids who can't be vaccinated yet safe. And I know people still have questions about vaccine. We have some new interest in vaccine. We've got some new pop-up clinics for vaccinations. And I know you were talking earlier on the show about, availability of vaccination. I would just encourage people to get their questions answered. If anybody listening to this wants a speaker to come talk to your school, your church group, your community group, where your business place, so that people can have their questions answered, you are free to email me. I can get you in touch with the right people. If you've got a specific concern that you want to address, fertility, or, what about people who have certain autoimmune conditions? We've got specialists who can speak to that. So my messages are really simple. Vaccine is how we get out of this. But if you're not vaccinated, or if someone you love, someone you know is not vaccinated, there still are ways to keep them safe. We've seen it. Masks do work.
Yeah, Dr. Jane Kelly's assistant epidemiologist for the state of South Carolina, Jennifer McConnell, director of Brooklyn Academy, CDC, Nurse Eunice Jones, nursing services supervisor with Richland One, Shay Harley, and Mara, his beautiful daughter, and Johanna and Jamie Bridget. Thank you guys so much for joining us today. I appreciate the open, honest, spirited conversation. Thank you for joining us and sharing your perspective. Good luck. And God bless you all. Thank you.
Thank you. Bye-bye.
Thank you.
Shout out to Girls Empowerment Network.
As you can see, the information for all of our guests has been on the screen and will continue to be on the screen. Now, if you have a story or initiative that could help someone cope with COVID, please go to the TaylorMade production page or the In It Together page and inbox. We would love to get your story or initiative on the show. If you have a product or service that could help someone cope with COVID, please email copingwith@tretailor@gmail.com. And we would love for you to be a proud sponsor of Coping with COVID, just like SCDHEC, the City of Columbia Office of Business Opportunities. In It Together SC, the Diabetes Advisory Council of South Carolina, Computers Unique Dutch Square Mall, Palmetto Media Connections, also the Comet Bus System, Agape Counseling and Training Services, Palmetto Painting Services, Javis Tax Services, and the Fifth Circuit Solicitor's Office of Richland and Kershaw County, who will be with us next Thursday and every second Thursday. Listen, coming up tomorrow, we are going to talk about that eviction moratorium. Edie Lane is going to join us. She's with Lane Law, and Sue Berkowitz with Appleseed Law are going to talk about how to protect yourself and all of the ins and outs with the new moratorium. Also, we're going to do Fun Day Friday with George Wallace. We didn't do it this Monday, but we're going to do it this Friday. And then coming up next week on Wellness Wednesday, National Health Center Week, then we're going to talk also in the coming weeks about breastfeeding and mindfulness, what makes you happy. Also, we're starting a new series on coping with COVID, Franchise Friday. Have you ever wanted to own a European Wax Center or maybe a McDonald's or maybe a Subway? Well, we're going to talk with all of those franchise owners and more and hook you up with some information that you need to know business and financial wise about getting your own franchise. That and more coming up on Coping with COVID. As usual, I leave you with a reading from Jesus Calling. Today is August 4th, but I want to read yesterday's because Johanna posted yesterday's. And even though I read it yesterday, it hit me differently after I read it. And this says, watch your words diligently. Words have such great power to bless or to wound. When you speak carelessly or negatively, you damage others as well as yourself. This ability to verbalize is an awesome privilege granted to only those I created in my image. You need help in wielding this mighty, powerful responsibility. Though the world applauds quick-witted retorts, my instructions about communication, the Lord says, are quite different. Be quick to listen, slow to speak, and slow to become angry. Ask my spirit to help you whenever you speak. I have trained you to pray. Help me, Holy Spirit, before answering the phone. And you have seen the benefits of this discipline. I have. I don't know about you. Simply apply the same discipline to communicate with people around you. Pray before responding. Those are split-second prayers, but they can put you in touch with the Lord's holy presence. And this way, you're speaking concerns under the control of my spirit. As positive speech patterns replace your negative ones, the increase in your joy will amaze you. That's your Jesus Calling. That was yesterday's. You got to go ahead and read today's too. I'm Tre Tailor. Hey, thank you so much once again for joining us on Coping with COVID. Until the next time, I wish you peace, abundant blessings. Stay careful, stay safe. Don't forget to get your vaccine. And please, as you heard Dr. Kelly said, I'm not just saying it. You need to wear your mask over your nose and under your chin. I'll see you tomorrow.
Coping with COVID and In It Together present Wellness Wednesday, brought to you by the Diabetes Advisory Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Tre Tailor.